Hey, this is Dr. Walker from denwalker.com. Welcome back to the channel. Before we get too far into this video, if you like our content, go ahead and give me a thumbs up or a like, and you can also turn on your notifications to get updates as to when a new video is posted anyway. So today I'll talk a little about really diet and as it relates to cancers. And I bring this up because of a discussion I had a few weeks ago, and I sort of alluded to it a little while ago with my discussion with another person from the surgical team, and it wasn't what I expected for them to hear from them. The initial discussion was about whether or not there's a dietary discussion for or with a patient once there is a known malignancy, known cancer. And it was, again, what I assumed was happening. It was not happening. I've been in medicine over 20 years, and again, I assumed that happened, that there would be a discussion about a person's diet once there's a diagnosis of cancer. Once the biopsy came back and it was cancer, then there's certain things that they would have to do and should do to have the best possible outcome. And it's not happening, and I was, again, really surprised about that. So here is what I'm saying. So I think once you have a diagnosis of cancer, a few things need to happen. And again, listen to your doctors in terms of what they're telling you the regimen should be in terms of treating a cancer. But the other part, which I think is not discussed a lot, is what should you do when you get home, right? So cancer, most cancers love an acidic environment, which means that if you want to have a non-acidic environment in terms of your body, then you should cut back on things that tend to be more acidic. Processed foods specifically, canned processed foods specifically, can make your body much more acidic. You need to have a more basic, sort of more alkaline sort of diet. The other part is cancer also love low oxygen state. So if you're a person that tends to sit on the couch and watch TV after you come back from your doctor, that should really stop. You need to, basic things like breathing exercise, and there's a whole bunch of those online. Other basic things like walking, increasing your respiration, increasing your heart rate, all of those things get more oxygen to the cells, specifically to the body, specifically to treat and handle and manage the cancer. Because if you don't, then you become more acidic and you become more hypoxic, or you have low oxygen states, which is exactly what the cancers like and tend to like and manifests itself in that sort of way. The other thing, and I think it may be just a little bit more important than the other two I mentioned before, is sugar. Most cancers that you have that's out there, they grow, and how they grow, one way of growing is the amount of excess sugar you have. Sugar, glucose, processed foods, high carb foods, high fructose corn syrup, again, processed foods, all of those things typically are loaded with sugar in the form of carbs, which then gets into glucose, and from glucose it gets into sugar, and the sugar is what we're talking about that the cancer actually needs to help it grow. Which means that you need to reduce your sugar consumption, processed food consumption, high carbs, so the white flour, the pasta to include wheat, spaghetti, for example, peanut butter, all of those processed foods contain lots and lots of sugar and lots of added sugar. So you need to back away from a lot of those things. Reduce if you can, reduce the amount of sugar you can. Any excess sugar that you're consuming that does not go directly to your metabolic health, i.e., how much sugar you actually need per day to survive. And technically, you don't need to eat glucose. The body has its own way of creating energy for you. So if you are able to decrease your processed food consumption, it's just that we're talking chances of you doing well in terms of fighting the cancer. But if you go home and you're not working out, you're not walking, you're not breathing, you're still having SpaghettiOs for dinner with a diagnosis of cancer, it's a whole lot more difficult for your system to help fight that cancer. Yes, chemo may work for you. It would work better if you had a good diet. It would work better if you were still exercising. It would work better if you're living in sort of your body living in a sort of more basic environment. It would work better. And again, I'm surprised that that is not a typical normal discussion with patient. It's okay, you've been diagnosed with this. Okay, we have this chemo regimen for you. We have this radiation regimen for you. But there is no discussion about what else you can do on the other end, right, to fight that cancer. And the last thing I'll tell you really is your mindset. So if you are still fragmented with a whole bunch of other ancillary things, sort of, worried about the bills and stressing about the car payment and stressing about the rent and stressing about all these things, all of those stresses, all of those things you're stressing about increase your blood sugar levels. And as I alluded to, the higher the blood sugar levels, right, the more free sugar you have in your system, the better you are at allowing the cancer to grow. The more sugar you have, and again, from stress, the more the cancer will grow. So your mindset has to be great. Your mind has to be in tune with more relaxation, more focus, more happy thoughts, more happy mood, and sort of just knowing that you're going to beat this. Not just saying it, but feeling it, thinking it, knowing it. Just know that you're beating this thing. All of those things help to align yourself with a better outcome from whatever you're dealing with. And it's not just I'm talking about cancer today, but that mindset piece, and I'll talk a little more about that, going forward, is another key factor, which I think most of us, physicians I'm talking about, most of us haven't begun to touch yet for patients, which I think is a great disservice, because that is the other part to you're being well, you're getting better, the other part. So yes, from a medical standpoint, we can give you things, drugs, medication, whatever else. We can give that for you, but then the fight against the cancer, or the fight against whatever disease process you're working with or you're suffering from, that fight continues when you go home. And fighting it when you go home is the other part, where your mindset sort of help you deal with those things. So if you can get rid of all those sort of ill feelings or regrets or dislikes, or this person doesn't like me, or that doesn't work, or this bill is not paid yet, and how the car payment is going to work, and how the house payment is going to work, all those things, all of those things make you more helpless against fighting the cancer. In fact, those things will help the cancer or whatever disease process to grow. Stress in and of itself will help that cancer to grow. Thanks for listening. Take care. God bless.